UDN has been advocating over the past few years. One of the colleagues from UDN will give a background perhaps on the organization, but basically they advocate for public, a strong public finance management system in the country, and want to thank them for organizing this particular dialogue. We are gathered under the theme, improving synergies between social protection and public finance management in Uganda. This morning we'll have a team of guests who will help us to unpack the issues surrounding universal social protection coverage in the country. And we'll be having, or we'll be hearing from someone from the Ministry of Gender, Labour and Social Development. We'll also have a guest coming from the Parliament of Uganda. And then as well, we'll have one more guest from the Parliamentary Forum on Social Protection. I want to thank you all who have showed up for this public dialogue. And as usual, we'll be patriotic to our nation and to our region, East African community. Let's start this with the national anthems, and then we shall have a prayer. Thank you very much. Let's stand up for the national anthem, members.
Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Okay, thank you very much. Let's take our seats. May I invite Esther Mufumbo to lead us in our morning prayers.
Let's humble ourselves for prayers. Dear Heavenly Father, I want to thank you for today. I want to thank you for the gift of life. I want to thank you that we are convening today under your mercy, under your grace. Father, we pray for fruitful deliberations so that whatever we discuss comes in good for social protection of this country. We prayed all this and believed in the mighty name of Jesus Christ, our Savior. Amen.
Thank you very much, Esther, for this. Just as a reminder, last week we were here. We had a high-level workshop to discuss issues to do with social protection in the country. And we're delighted to be back this morning again under the auspices of Uganda Data Network. That has been working with support from UNICEF, who have funded them for these particular activities. We also have the EU as part of the partners supporting this activity. We have ILO, International Labour Organization, as well as the Global Coalition, Social Protection Flows. You're most welcome to this session. As I mentioned earlier, I want to introduce and invite our panelists to take their seats. Like I mentioned before, we'll have Ms. Beatrice Okilan. Beatrice Okilan is a policy and advocacy coordinator in the Ministry of Labour, Gender and Social Development. You're most welcome, Beatrice. Yes. I want to invite you to take up your seat. We'll also have Patrick Mutawazi Kichoncho, who is the coordinator of the Uganda Parliamentary Forum on Social Protection. He should be here in a few minutes. And we'll be hearing also from the Honorable Sylvia Bairera. She's the woman member of Parliament in Kamwenge District. But first, we shall hear from the Uganda Date Network Executive Director, who will be, of course, representing the organizations. He has sent a representative since he is not feeling so well this morning. So, Gilbert, Beatrice, could I invite you to take the podium and we start. As I mentioned, we will be coming to you live on NTV, and for the audience that will be following this discussion, we will definitely be expecting to hear from you. Please actively participate. The social media handles will be shared with you shortly as we continue these deliberations. We have stakeholders gathered here, basically stakeholders in the social protection issues in this country at the national level, and we want to thank all of you who have come here for this public dialogue. We could not have the opportunity to introduce each and every one of you individually. I hope during the plenary session we shall all participate and have the opportunity to give a brief introduction about ourselves before we proceed with the program. So, as I mentioned, we have our panelists up front there. We'll be joined by two others from the Parliament of Uganda as well as from the Uganda Parliamentary Forum for Social Protection. I want to take this opportunity to invite Mr. Gilbert Musinguzi. Gilbert Musinguzi is the Quality Assurance Manager at Uganda Date Network, and this morning he will be giving us opening remarks on behalf of the Executive Director of Uganda Date Network. Gilbert, you're welcome. Yeah, please come.
Thank you, Mr. Walter Akwat. Ladies and gentlemen, good morning. You are most welcome to UDN, Uganda Date Network. As you may have known, Uganda Date Network was formed in 1996, basically because there was the issue of public debt, and the highly indebted poor countries were being constricted, and there was a campaign called Jubilee Campaign where the indebted countries were requesting donors at least to relieve them from that debt. Since that time we have been moving on. Debts were relieved, we got slightly better, but then again we went back into indebtedness, and gradually we are like almost at 50-50 in terms of budget allocation. Most of the budget resources are acquired through debt. And given that background, we have a responsibility to address issues of social protection, because the majority of the people who are affected are the ones who are responsible for paying back these debts. So we partnered with UNICEF in order to address this issue of social protection financing. And we have had a short-term implementation of this project. Basically, we have addressed a number of issues in social protection. One, we engaged with local governments where we built the capacity of at least 160 local government leaders. That were CAOs, RDCs, councillors, and the like. We supported them in skills of domestic resource mobilization for social protection financing. And these were 8 districts spread countrywide, like in some regions, eastern, western, northern, and central. So having done that, we also engaged in some study. We conducted a study also on social protection financing, how effective, what are the gaps, what are the challenges, and the like. And we elicited a lot of information where we established a number of gaps that are in there, and also recommendations on how these gaps can be addressed, because we feel social protection is not adequately funded. So we also now, for that matter, had engagements with ministries, departments, and agencies that relate to this particular sector, and notably the Ministry of Gender, Labour and Social Development, because this study that we conducted, which we launched last week, it had issues which Ministry of Gender can be the champion, while the other MDAs can also be supportive, including members of Parliament, Ministry of Finance, and of course civil society and others. The issue of social protection touches us all. One immediate concern that we have put to government is that, one, when we look at the national budget, less than 20% of the national budget goes up country to regional governments, and the rest remains at the center. When we look at our demographics, the majority of the people in Uganda fall in the rural areas, meaning that this little money that we have, we give it to up country, where the majority of the people that are vulnerable fall. So we feel there could be need a greater opportunity for these people. If we could increase more resources to local governments, that would be a starting point. Because this, I think, is it 14% that goes to local governments. The majority of these resources, again, are for recurrent budget, salaries, rent, and the like. And then a scanty remaining bit goes to these other needs. We are appreciative that of recent, for example, some of the projects have been instituted by government, including SAGE, monies for people with disabilities, women, and the like. And of recent, of course, there is the parish development model. We appreciate government having taken this stance to ensure that at least these marginalized people are addressed. So at least PDM, it's an additional fund that we look at as a positive movement in that direction. We have called this meeting, finally, to kind of cap this other campaign of partnership. And we are appreciative of all the stakeholders who have been party to it, beginning with the local governments who gave us all these views, then the ministries, departments, and agencies headed by yours, Madam, Minister of Gender, where they gave us forums, they gave us information, but also they gave us a go-ahead. And because we are partners with government, we definitely have a responsibility of contributing to that area. So you have accepted us to partner with you in that area. So we are here. We have called, of course, members of Parliament. Some of them are here. Last week, we also facilitated some of them to go to the field, to the districts that we have mentioned, to establish and do the fact-finding mission, to establish the actual status of social protection issues. And the draft report indicates that, indeed, they also established that social protection is highly wanting in terms of resource allocation and service delivery. So this meeting now, as it caps the project and moves us in the direction of the next one, we are calling for ideas on how social protection can be upped. And that's why we have invited this strong panel of pundits that would be able to give us ideas, and of course the plenary, it's also the same. So let me take this opportunity to thank, apart from those other stakeholders who gave us information, mainly the development partner, UNICEF, funded by EU and others, for giving us resources in order to support this cause. With these few remarks, I wish everybody wonderful deliberations. Thank you.
Thank you, Gilbert, for the wonderful remarks. Let's give Gilbert another round of applause. Thank you very much. Again, I just want to reiterate this. For those of us who have just joined us for this dialogue, I want to welcome you on behalf of Uganda Debt Network. Today, we are here to discuss or to deliberate on the issues of universal social protection coverage in this country. And we're delighted to have a very eminent panelist to take us through this topic, for us to unpack the issues around social protection in Uganda. Last week, while we were here, we heard from one of the key speakers, Professor Suruma. He mentioned that no citizen should live in a subhuman state. Most of us here, we look like we're all in working class category. But again, we're also from Africa, and Uganda in particular. And we know the social protection issues that surround us, especially those of us who have the opportunity to be engaged in gainful activities. It was mentioned here when we gathered last week that quite a number of us actually bear the burden of taking care of our aging parents and grandparents and all that, because the social protection platforms or opportunities are not reaching out to everyone who should ideally be benefiting from this. But as I mentioned earlier, we have a team of eminent panelists who are going to unpack these issues for us, and then we'll have a moment during the plenary to deliberate further based on what they will have presented to us. I just want to again reiterate that we are here because of UDN, supported by UNICEF, with funding from EU, ILO, and the Global Network for Social Protection Flows. At this moment, I want to take this opportunity to welcome Madam Beatrice Okilan. Let's give her a round of applause.
I hope it is. Good morning, ladies and gentlemen. I have been introduced, but I can introduce myself again. My name is Beatrice Okilan. I work with the Ministry of Gender, Labor and Social Development. I work as a social protection policy and advocacy coordinator. I'm going to take you through the progress. I'll give you a brief overview of what social protection is, and then I'll take you through the progress of social protection in Uganda. So that's the outline of the presentation. We'll go through the policy context, vulnerability context, progress, then key lessons, challenges, and way forward. So, and the policy context, the government of Uganda recognizes social protection as a key intervention for addressing shocks, and the Constitution Constitution of the Government of the Republic of Uganda identifies social protection in its objectives, principles, and the vision, or the 2040 vision, also recognizes social protection and proposes a universal pension for every citizen above the age of 65, and also social protection systems for orphan children, disabled, as well as the destitute. The National Development Plan over the years, Development Plan 1, 2, and 3, recognize the contribution of social protection, and in this particular NDP 3, it recognizes the contribution of social protection to human capital development program. And of course, the National Social Protection Policy, which was approved by Cabinet in 2015, also identifies social protection as key intervention, and also carves out what social protection is in the Ugandan context. And why are we talking about social protection? We are talking about social protection because individuals are faced with risks and vulnerabilities, shocks across their life cycle. From the time a child is conceived, there are various risks that that child could face that will inhibit that child from developing its full potential. And so the analysis for social protection, the risks that individuals face, have been analyzed from the time a child is conceived through the early childhood to the school age going, youthful ages, working age, as well as the old age. And really, when a child is conceived, if a child gets unsafe birth, we all know that that child is susceptible to maybe infant mortality, but also various disabilities that can come up at that age. If a mother is not well fed during pregnancy, a child is vulnerable to stunting, and when that child is stunted, that child will not be able to develop its cognitive capacity. And of course, there are also various issues around that early childhood. While at the time of school-going age, of course, there are also various challenges that we face, and key is the issue of child labor, inability to attend school, maybe child abuse, and again, we see that that is common. Enrollment in primary one at 100%, but completion rate is very low. And so those are all the risks that people face along their life cycle at that age particularly, and they will not be able to grow into their full potential. Of course, there are also issues of malnutrition, which are high at that time, as well as inability to work, no care from the family, of course, discrimination, and most of the young generations are now wishing that their parents, the old people, may die so that they can inherit. So those are all the shocks that the older persons face. But what is important to note is that the poverty of older persons is almost double that national average. About 45% of the older persons are living in poverty, while almost 3 out of every 10 older persons are looking after a child. So those are some of the issues that we need to look at and consider. Of course, we talked about the poverty, we're vulnerable. our poverty levels, it is according to the last UNHS report, it was about 20%, which is good progress. It has been reducing over the years, but it's important to note that that 20% is about 8 million people that are in poverty, which we need to address. I talked about key vulnerabilities. About 53% of children experience multi-dimensional poverty in various aspects. But it's important to note that stunting rates are still quite high in Uganda, in spite of the fact that we have very good climate as well as the soils. It's at 20%. Child labor is at 28%. And so you can see we talked about inability to develop a cognitive capacity, which will of course transform to poor performance at adulthood. A dependency ratio is high also. 92% of the working age dependency. High incidence of shocks. I think we are all familiar with shocks in Uganda, especially the climatic-related shocks. You find that drought is a common shock. About 72% of households have experienced drought in the last 5 years. Floods are common, as well as pests and diseases that affect agricultural produce, and later also affects the prices, and of course that reduces on the incomes of the agricultural population, which is the majority of our population. When we look at that, both the available services, social security services, are still quite low. Both the National Social Security Fund and the public service pensions cover just about 5.7% of the estimated working population, while the programs that government is implementing, the senior citizens and the public service pensions, cover about 18% of the older persons that need social security. Of course, there is high out-of-pocket expenditure. That is when we fall sick, we have to have money. If you do not have money, you have to perhaps sell an asset or do something like that. You might be able to identify with that. Also, the contributory savings, especially the NSSF, the payout is still low because of the incomes of the people. And so when the average is about 12%, at 12%, if you get, 12 million, if you get 12 million at your retirement, I don't know how that will support you to live a sustained good livelihood at old age. So those are some of the risks and vulnerabilities in Uganda, but that is what social protection is trying to address. Why are we talking about social protection? How does social protection support what we have just said? It promotes a healthier population by improving nutrition, food security, and access to health care. It also leads to a more educated and adaptable workforce by increasing school participation, reducing child labor, and boosting performance. It also contributes to a more dynamic economy by enabling people to work in better jobs, open businesses, increase consumption, and be more resilient in terms of shocks and have access to financial services. And it also contributes to a more stable and cohesive and dignified society by improving people's dignity and well-being. So that is broadly how social protection contributes to reducing those shocks that we talked about. And so we would like to briefly look at what is our understanding of social protection in the Ugandan context. The National Social Protection Policy, which I talked about earlier, defines social protection as public and private interventions to address risks and vulnerabilities that expose individuals to income deprivation leading to undignified lives. So it's both public and private interventions addressing risks and vulnerabilities that expose us to income. So social security is a protective and preventive interventions to mitigate factors that lead to income shocks and consumption. So it is protecting from income shocks, protecting and preventing income shocks. That is social security. And it has two components. One is the direct income support. Direct income support is non-contributory, regular and predictable cash or in-kind transfers that provide relief from deprivation to the most vulnerable groups in society. So direct income support has to be regular, has to be predictable to those that are deprived. Examples in the Ugandan context is the Senior Citizens Grant, popularly referred to as the SAGE, the disability grants, maybe child grants, but also the public works, labor-intensive public works schemes, like the labor-intensive public works components under the NOSAP 3 program, and then the development response to displacement, that is the Dr. DEEP. They also have a component of labor-intensive public works. And so those are the categories, but also the food that is given to people in emergency situations is also categorized as direct income support. While the other one, which is the social insurance, which are contributory risk pooling arrangements that seek to mitigate livelihood risks and shocks arising from ill health, retirement, or disability. So their second component is the social insurance. You contribute while you can still work to mitigate shocks when they occur. And examples include the Public Service Pension Scheme, the NSSF, various health insurance schemes are all categorized under that. Pillar 2, which is the social care and support services. These are a range of public and private interventions designed to alleviate social-cultural vulnerabilities to individuals who are not able to take care of themselves, but who may also face neglect, abuse, exploitation, and social inclusion. And this one really looks at how do we take care of the very vulnerable, the persons with severe disabilities in our households, the older persons, not just giving money, but they may need some care. The chronically ill, and the terminally ill, how do we take care of them? So that is what that Pillar 2 of the National Social Protection Policy covers. And it has 5 components. One is care, really provision of support, personal care, support for daily living. How do we, that practical life of daily living, eating, washing, hygiene, all that. But also mobility within the household. Specialized care, which is access to specialized treatment, medical care. Protection, which is primary prevention, as well as safeguarding, which is prevention from harm while in care. and then empowerment, which is provision of information, knowledge, livelihood skills, as well as confidence building. And so that is our definition of social protection and the components. I'll not go there. This is just what I talked about, the components and what is of social care and support and what is in there. That is a framework for definition of social protection in the Ugandan context. What I have just been talking about. At the center is the vision, which is a secure and resilient family, socioeconomically resilient, and then the two pillars of social care and support and social security. But the policy recognizes complementary services, that there is need for other complementary services to support the families so that they can be able to be resilient to the shocks. And so it recognizes all the other policies and interventions as contributory, including the income-generating programs, health policies, education, financial, employment, all that contribute to a secure family. So what did the policy set us to do? The policy set us to look at 7 priority areas. One is the reform of the public service pension scheme from tax financed to contributory. Expand social security in the private sector to include provision of pensions. That is targeting the private contribution, the NSSF. Currently, it's a provident fund. So that means it's like you save until a certain age. When you're eligible, you will withdraw your resources. But again, studies have indicated that after people have withdrawn that money, in the span of 2 years, there will be no more money. They will have spent that money. And so they will not be able to smoothen their income or live that standard of living. And so we need to reform and see that NSSF also provides a pension to the beneficiaries. Develop appropriate social security products for the informal sector. Again, informal sector is not covered, but the policy has proposed that, and the government of Uganda is working towards that. Introduce affordable health insurance scheme, which is affordable to everyone, universal health insurance access. So that is what the policy proposes. And then expanding access to direct income support by vulnerable groups. And this includes expanding grants to those that may need those grants, like the Senior Citizens Grant. When the policy was being designed, the Senior Citizens Grant was in 15 pilot districts, but for now it has been expanded, rolled out nationally to all older persons aged 80 years and above. But the Constitution says older persons is from 60 years. So there is need that we reach out at least to those aged 75, at least, or 70, so that to access. But also there are other categories that might really require this support. For example, when we look at persons with disability and persons with severe disability, children, they incur a higher cost to access services. So with the policy is proposing that they need to reach out that category to support them access services and also be able to attend school, but also strengthening family and community capacity to provide care for those groups in need of care, and then enhance the institutional capacity for provision of comprehensive social protection. So that is what the policy set out to do, and that is what we are working on. This slide talks about who is responsible. Again, what I talked about, the priorities you might see, it's not just Ministry of Gender. There are other ministries that are responsible. Ministry of Gender is responsible for providing oversight and standards for social protection, but there are other key government institutions that are responsible for leading other priority interventions, like Office of the Prime Minister has been leading on labor-intensive public works, Minister of Public Service on public service pensions reform, Minister of Health on national health insurance, and then the Minister of Finance and Minister of Gender together to expand social security to the informal sector. But other agencies like Minister of Water and Environment, Minister of Water and Transport, Minister of Works and Transport, Minister of Water and Environment, ICT, local governments, agriculture, as well as NSSF and URBRA all have key roles to play. So where are we at? What are we doing? That slide shows what we are doing under the direct income support programs. The number one is the Senior Citizens Grant, which I already talked about. It has been rolled out to 80 years and above, and it covers all the districts. The source of funding at as of now is fully Government of Uganda, and it reaches about 332,000 beneficiaries. But this is a flagship program, and it is ongoing. The other programs are really not embedded yet, not embedded in the taken over by government, and for social protection to be sustained, government has to lead, government has to take on. And so other programs like the Labor Intensive Public Works under NOSAF 3 and Dr. Deep, NOSAF 3 of course has ended, and we're hoping that the subsequent program shall be approved. But that was the coverage, and it reached that number, while also government currently implements special grants for persons with disabilities. It's also a national grant supported by government. There are other various pilot programs like the Pilot Urban Cash for Work, which is just in one city, in Arua. The disaster risk financing was piloted under NOSAF 3, and it gave us very good lessons for disaster risk financing. WFP together with SIDA, the Swedish International Development Agency, are supporting the government of Uganda to implement a NutriCash program in 8 refugee hosting districts, and it targets pregnant and lactating mothers from 0 to 1,000 days of a child's life. And we hope that when we intervene at that stage, we will be able to arrest the issues that we talked about under children, the stunting, the cognitive development, that is, and also the nutrition. So that is what that program is trying to do, but the really lessons, it's in West Nile. And then we had various programs under the COVID relief. On the contributory social security, we have various programs running, the NSSF, because some of the achievements is that the Act was amended to provide for that midterm access at 20% for those that have contributed for a certain period of time. And then there's also opening up of that NSSF to allow voluntary contributions. We think that really that should be able to reach out to the informal sector. But the coverage mandatory scheme is about 2.2, but it's about 50% activity rate. The public service pension scheme, the reforms are ongoing. Membership is about 388, but about 88,000 are actively benefiting, while there are various occupational schemes that have been registered by URBRA, but this include the retirement benefits like Parliamentary Forum, Makerere University, and all those. They reach about 42,000 people. voluntary private, which Uganda Retirement Benefits Regulatory Authority has license reaches 4,200. Health insurance is being worked on by Ministry of Health. I think it is progressing very well. While expansion of social security to the informal sector, the strategy is being finalized, but like I said earlier, NSSF review of that act has opened it up, and again we are getting good benefit feedback from that. Community-based health insurance schemes are also operational. There are various NGOs that are supporting in about 59 districts, reaching 165,000 people. On strengthening the social protection systems, the Ministry of Gender is hosting the National Single Registry for Social Protection, and this registry is a repository of beneficiaries of social protection, and this helps us with targeting, but also monitoring and ensuring that we target those that are actually not benefiting from other interventions. So Ministry of Gender is also working on the social registry. It is something that we need to take forward, having learned from the experience of COVID, when government wanted to reach out to those that were in shock, but it was not easy to identify who to reach out to. So we need to develop a social registry so that when there is a shock, government and other stakeholders can come to that registry to identify those that need that support and be able to respond in real time. We're developing a social protection strategy which has come out of a social protection sector review that was done in 2019. It was like a midterm review of social protection and emerging issues that came out. Key, of course, was the shock responsiveness, that we need to have our social protection programs be able to respond to shocks. And so that social protection strategy is taking care of that, as well as emerging issues. Then we need to strengthen the social protection systems for delivery again, so that we know that we can deliver social protection. If we are sending cash, what is the established system that we can use to deliver cash to the people in real time? And then also coordination mechanisms have been strengthened. On the social care and support pillar, the minister has just concluded a social care and support system, and key priority interventions under that is to increase access to specialized care, that we should be able to access that specialized care even at the village level. The people with mental health issues, the persons with disabilities should be able to access. Improving family and community support so that they can be able to take care of their vulnerable ones, and also building capacities for delivering of social security. So that is where we are at with that. That strategy is now at the approval level, and we shall get it out soon, and we think that it will improve the services for the vulnerable. On financing for social protection, we have made some progress in that area, because government has taken on the financing of the senior citizens grant, and you can see that some good amount has been provided, but also other programs like special grants. But also when you look at the graphs on your right, government support has been increasing. In the earlier years, you could see the blue, it was mainly donors, but now we see the donor support is reducing, government is increasing. What have we learned over this period? We have learned that progressive design and introduction of new grants enables government to plan and prepare for takeover of programs. A progressive design. The policy stipulates that government will take on other grants, social protection program, based on its capacity, both physical capacity as well as administrative capacity. And I think that over time, that is what we have learned. Strong evidence is very key, and of course, political support, social protection has been supported by our political leadership. Strong evidence-based long-term development partner support has been really key in building systems for social protection, but also we think that consolidated off-budget as well as on-budget funding for social protection is key for taking forward social protection. We also think that we need to protect the transfers, the cash transfers. But key is integrating shock response in social protection programming to mitigate impacts of shocks and to ensure timely delivery of benefits. And then also for us to effectively tackle vulnerability, there is need to introduce additional direct income support, which we talked about, especially the disability grants. What are key emerging issues? Budget allocation for social protection does not match the NDP targets. We need to improve on that. There is a huge demand for lowering the eligibility age as well as increasing the benefit amount for the senior citizens grant. But of course, given the fiscal space, that is what we need to look at. The other issues is, of course, our expenditure, the Ugandan expenditure on social protection as a percentage of GDP is still low when you compare to other countries, other African countries. At 5.5, you can see that is the highest is South Africa. They spend about 5.5% of their GDP on social protection. Zimbabwe is at about 3%. Ghana is about 1.7%. The rest, Ghana, Rwanda, Tanzania, Kenya, and then Uganda is here at about 0.7%. So we need to work towards that. We also talked about over the years, the purchasing power for the senior citizens grant has been eroded. We need to increase that. But also the refugee situation is not improving. And as we are all aware, we are hosting 1.5 refugees, but all these with its effects on the environment and the resources that are available within those communities. So we need to address, but also the disasters which I already talked about as increasing, and we are aware and we know that they are there. And so we need to address that. Those are some of the challenges that are emerging, which we need to address. Where do we want to go? We are talking about that comprehensive social protection strategy. The Ugandan social protection was designed to cover, to address life cycle risk from childhood to old age. So we need to really up our game and see that we can address those risks, but under contributory social security, the health insurance scheme is very important, as well as expansion to the informal sector. I think we also key here also is that we need to build partnerships to take social protection forward with various ministries, departments, agencies, development partners, private sector, as well as civil society organizations. What are the opportunities that we have to expand fiscal space and investment in social protection? Our GDP is expected to grow in the next 5 years. So we think that if we expand the senior citizens grant by lowering the age and increasing the benefit level, the child grant, the child disability grant, will cost the government just about 2% of the GDP. Expansion of social protection to the informal sector is, I think, very key, as well as to individuals. We think that this will generate long-term financing, but also social security expansion. The a study was done by means of gender, labor, and social development, together with means of finance on modeling investments, modeling social protection investments, and it indicated that to invest in infrastructure is comparable. The benefits are comparable to investing in social protection. So as we invest in infrastructure, which is our priority, social protection also will lead. If we equally invest in social protection, we should be able to get equal benefits. The cost of inaction to support children, especially from poor families, makes us to miss our demographic dividend. We have advantage of those children, but we need to keep them in school, get them skilled, and be able to participate productively in the growth of the economy. And so we can no longer wait. We need to do that. Comprehensive health insurance is key in alleviating the suffering of individuals, but also to improve the shock profile. Leaving no one behind will require a deliberate focus on increasing investment in social protection. And that is what I want to end with. There are various benefits from social protection interventions. The SAGE that we have done, we see that older persons, as they can invest in animals. This also increases, the market, the economy, boosts the economy of the communities during paydays. Older persons can also invest in small animals like pigs. They also improve on their housing. As you can see in that lower picture, an old man from Chenjojo improved his house from that grass thatched, if you can see, to that household. So that is what some of the contributions and benefits of social protection. I want to thank you very much for listening.
Thank you very much, Ms. Beatrice Okilan, for the presentation. Please, let's give her another round of applause. I have no doubt that she has done justice to this topic and expanded on our knowledge on issues concerning social protection. I know we have all taken down some key takeaways from our presentation, and we shall have the opportunity to discuss this further during plenary. Just one thing, Beatrice, that you mentioned in your presentation that really touched me, and I want to find out from the audience. Do we have amongst us people who are really praying for their parents to depart so that we inherit their property? That's how bad things are. So I hope that none of us here is in that kind of situation. But again, we all know from our communities that these are the realities that are existing in this country, and we certainly need to see improvements. I want to thank those of you who have just joined us for this public dialogue. You're most welcome. As I mentioned earlier, we are here to discuss, to deliberate on issues of universal coverage of social protection in this country. And we have eminent panelists to take us through this. So I want to thank Beatrice. Ms. Beatrice Okilan is a Policy and Advocacy Coordinator in the Ministry of Gender, Labour and Social Development. I think she has given us a very good presentation this morning. Thank you, Madam. As I mentioned earlier, we have two other panelists to help us discuss further and understand some of these issues of social protection. We have the Honorable Sylvia Bairera. She's the woman member of parliament for Kamwenge district. And we shall also be joined by someone from the, I hope he's here already, from the Uganda Parliamentary Forum for Social Protection. We hope Mr. Mutabazi will be joining us shortly. But for this moment, let's welcome the Honorable Sylvia to come and discuss this topic and give us some highlights. You sit at that privileged level of policy, and therefore some of these issues that we are discussing, how do we add more funding? Beatrice has just told us here that we are spending only 0.2% of our GDP on issues of social protection, and South Africa is at 5.5%. How do we plug this gap? Could we have the Honourable Member of Parliament coming to take us through this? Please, you're welcome. Let's give her a round of applause.
Good morning, members, panelists, and members. My name, once again, as introduced, I'm Sylvia Bahireira, and I'm a woman member of parliament representing Kamwenge district. I'm happy for this meeting on a critical issue of social protection that seems a new concept to most of the people when we mention it out there, and yet it is very critical, and it has been sometimes implemented unconsciously and sometimes neglected unconsciously, yet it must be taken care of in our communities wherever we live to avoid the risks and increased vulnerability to our risk groups. So I would like to thank in a special way Madam Beatrice Okilline. Okay, I think I wrote it badly. Okilline. Madam Beatrice Okilline for a very good and comprehensive presentation. We realize that painfully we have very many people who want to take advantage of the vulnerable people whom we are supposed to protect in our communities out there and at our places of work, to the extent of some people wishing their parents to pass on so that they inherit property. It is absurd, but it's real. It's the truth of the matter. It's common out there. And now, the people who would be protecting these vulnerable people are the ones actually making them more vulnerable. You find even situations where someone has retired, but they delay to get their pension, and yet at least this pension is there in the 0.3% that the government has put aside for the vulnerable groups. You find someone losing a wife or a husband, a spouse, and they are entitled to, let's say, death gratuity. They have been, say, in a former employment, but someone responsible to process this benefit timely is causing unnecessary delays because perhaps the delay tactics have other intentions behind it. So we find that each one of us here has a role to play, that there is a gap we have created in one way or the other. People out there is a gap they have created in one way or the other, sometimes even unknowingly. So this meeting is really very important and critical because we are the ones going to tell communities out there what each one of us is supposed to play. And as government, I have a thinking that, generally speaking, we have goodwill for political support and on grants and budgets, but our budgetary allocation is still very, very low, 0.3%. 0.7? 0.7. Oh, the latest document I read was 0.3, okay, 0.7. Okay. 0.7%, very, very low, not even 1%. And it's good we have partners who are advocating for this. You know, you cannot push alone politically. You need to have civil society organizations, you know, different organizations coming and sounding in the same sound, advocating for the same thing. And once the advocacy is significant, the voices are really significant and loud enough, then political support will always be there. Political support will always be there because, you know, when it comes to budget allocation, especially for us as parliamentarians, we need a lot of advocacy. You know, it is scientifically proven that resources are never enough. Resources are ever scarce. But once something is pushed by different people with empirical reasons, with empirical data, definitely the government has to listen. Definitely, when we are appropriating budget, we have to increase on something. And social protection, there is no question about it. It is very important in our communities because we are advocating, we are protecting for the voiceless, for the helpless, the children, people with disabilities, the elderly. So you can see that all these categories are voiceless, they are helpless. We are the one to do what? To push for them, to advocate for them. But what I want to assure you of, the current parliament, the 11th parliament, all members are really in for the vulnerable groups. Because I remember, like, in the last budgetary process, there's actually where we reached and we were like, if money for the elderly, the youth, the women entrepreneurs, WEP, is not looked into, we are not passing this budget. If you say that these programs should, their budget should be scrapped off and everything is put, because they are at some point, some people propose that these programs should also be under parish development model. And members were like, no, we cannot mix these things. If WEP money is not there as standalone grant, as standalone funds, we are not passing this budget. If youth livelihood funds are not clearly defined, if SAGE funds are not clearly defined, we are not passing this budget. We shall not keep on mixing things and assume that we are working, moving forward, and yet we are moving backward. So, as a parliamentarian, I would like to assure the Ministry of Gender, Labour and Social Development, our different partners who are here, that please, your advocacy, your voices cannot be in vain when you are advocating for vulnerable people, for the voiceless people. We shall work together to see that we move from 0.7%. We are the lowest in the region. we are the lowest in the region. Not so, Madam Beatrice? So we shall work together to see that we move at least relatively closer to where the other countries in the region are. If not, then we shall continue to render our communities to keep at risk. So be assured of our support in this budgetary cycle that is soon starting. We may not increase something very big, but at least something. Okay? Of recent, I want to end with the one case study, one case where I was personally conducting medical camps. I was taking health services closer to people in my district, to especially communities that move more than 5 kilometers to access a health center. So during these medical camps, I learned a lot. Well, for us, whatever you do, they think you are doing it politically. But you learn a lot out of it, you as an implementer. Though in the face of the public, they have a thinking that you are looking for votes. You are trying to position yourself for the next vote, for the next campaigns. You are looking for votes. But when I was conducting these medical camps, I realized the vulnerable people, especially the elderly, are really bad off in our communities. They are, first of all, they have aged. They don't move long distances to go and seek health care. They don't have money to use easier means of transport like border borders or body taxi. So they tend to keep home, struggling with weakness, when actually they don't know why they are weakening. Their health is weakening, their bodies are weakening. So when we were in the camps, we got some cases where you would find, let me give you an example of diabetes and high blood pressure, because it's the one that hits the elderly so much, those two conditions. You would find someone with high blood pressure, which is high to the level of getting stroke. It would be above 200 millimeters, me I'm a health worker, it would be above 200 millimeters of mercury. And when high blood pressure is above 200, you are a candidate of stroke. Anytime you get stroke and you go down flat for some months, or even if you don't have a family that really gives you that social support of health care, you end up dying. But they would get to know that they have such high blood pressure for the first time. You would ask them, which antihypertensive medicines have you been taking? They will tell you, me, I've never tested for pressure. This is my first time. But I've been getting a headache, serious headache, and I would think that perhaps it's because of the work I do at home. Someone with high blood pressure of a level of getting stroke. So that's when I realized that our old people are really in a sorry state in our communities. These are people who go to bed, they just shut down. The family members remain asking themselves that what has killed our person? What could be the cause of death? They will never get an answer forever and ever. They have lost their dear one. And yet, really, these people somehow still are productive in our communities. You would find someone with diabetes which is so high that it cannot be read, it could not be read by the measuring gadget. It would not give you any readings. It would just show you that it is high. So, as we plan, as we advocate for our vulnerable people, especially the old, I have a thinking, and actually I want to introduce it to my colleagues, the parliamentarians. We push for it so that when there is programs like SAGE, where you're sure a good number of elderly are gathered together, we could have there a component of wellness clinic, wellness, because at times for them, they know they are healthy, they don't have any problem, not until you investigate. So when they have such a program of SAGE, and we have there a simple team of health workers to test some of these key parameters, we would help our people not to die in darkness when we don't know the causes of death. That is one case I wanted to give, and I think I can stop here, but I have assured you of our political support. If you also give us enough advocacy, engage our parliamentary committees that work on this, feed them with enough information as civil society organizations, as ministries, as organizations, so that we really see cause of raising the budget from 0.7% to another significant level in this process of budgeting, because each one of us has at least a friend or a relative who falls in this category, and we are the ones to care for them. So before I sit, I would like to welcome my colleague. There is my colleague, Member of Parliament, who has just arrived, Honorable Odoi Onen. Honorable, you can introduce yourself. I don't have to be your mouthpiece, and yet you have arrived. Thank you very much, members.
Thank you very much, Honorable Sylvia Bairera. Let's give her a round of applause. Honorable, thank you so much for the discussion. But more importantly, thank you so much for that assurance of the commitment of the Parliament of Uganda to support this advocacy that, that the stakeholders in issues of social protection are pushing for. We hope that we can increase our percentage allocation to social protection from the current 0.7% to, I don't know which percentage you didn't give us any particular figure. I hope we can go at least up to 3%. Yeah? So that we you can be assured on our side we will not get tired of advocating and pushing for more for as long as the police does not threaten us with arrest. We'll continue doing that. We want to thank you for the time and for this discussion. Again, ladies and gentlemen, I want to thank all of you who have joined us for this public dialogue. As we mentioned earlier, this is organized by Uganda Debt Network, of course with support from UNICEF, EU, ILO, and the Global Coalition for Social Protection Flows. As I mentioned earlier, we're coming to you live on NTV, and want to thank all our participants for showing up. We're expecting to have someone from the Uganda Parliamentary Forum on social protection. I think he's not yet here, but we'll want to take this opportunity, because time is not our best ally. We want to take this opportunity to open up this debate for the plenary, to give your views. The Honorable was just joined us. Could we have the opportunity to have you come introduce yourself, and then maybe also back up what your colleague just told us? What we need right now is that political will. We know one thing, that when it comes to amendments, our colleagues in the Parliament, you are very fast with some of these things. We amended the age limit very easily. You heard we were talking about the proposal to bring down the age of benefit for SAGE from 80 years to 60 years. We want to hear from our MPs whether this is going to be very possible to get this kind of amendment. We have done it before, really, very easily, and I hope we can do this easily. Please come and give us that assurance.
Thank you. Thank you so much.
the honorable colleagues, the partners, distinguished ladies and gentlemen, good morning. My name is Bernard Odoi Onen Mutusa. I come from Eastern Region. I represent the youth of Eastern Region from Jinja to the borders of Karamoja. Social protection must be part and parcel with my intention as a leader. I want to join my team and also pledge that we must be deliberate on this, because you talked of reducing the rate, taking the age group down of our elders to benefit from the funds that we appropriate. I think it doesn't beat logic that when we are young, we are supported by these adults. And also as we grow, we need also to support them. It's a fact of life, and it is us, as citizens of this country, as policy makers, as people who sit on the round table and appropriate resources for the betterment of our country, to ensure that we protect the vulnerable communities of our society. This includes the elders, the PWDs, the women, the youth, in a very meaningful way. As a member of parliament representing the constituency that constitutes the majority of the population, the youth, where you find the PWDs, where you find also the ladies in big numbers, I want to assert that I will stand firm to ensure that we walk the talk. Like you talked of very many amendments that have taken place in Parliament. This is even core to our society, because when you protect and support this segment of our people, you just giving back. You're building for tomorrow, and you're being exemplary, and you're giving hope to both the elders and also the young one. As a member of Legal and Parliamentary Affairs Committee, where most of these bills are cooked, I want to reassert that when it comes in our angle, I'll be part of the voices that will stand firm and ensure we support this core of our community, and ensure that even after we have appropriated, I want to report here that just 24 hours back, we were in Western Uganda, where we went on an outreach organized by Uganda Deep Network on the same. So this is a cause for which I am very deliberate on, and I will keep the fire burning. Thank you so much, and may the good Lord bless us as a country, as policymakers, as leaders, and to our partners, tusonge mbele. Asanteni.
Thank you very much, Honorable Odoi, for that assurance and of your commitment, as well as the commitment of Parliament to some of these causes by the civil society. I think what the civil society members are doing, as well as really all the stakeholders in issues of social protection, led by the Ministry of Gender, Labour and Social Development. We are all trying to improve the situation of our aged people, but also the more vulnerable categories of the people in this country. We have certainly a huge percentage that deserve to get this. You heard that about 20% of this population, or that's about 8 million people, or 8 million citizens, are in the category of people who are living below the poverty line. And we can't really lobby enough for ways or means to improve social protection for this kind of categories of people. But really, we want to open up this debate now to the audience. Like I said earlier, if you have any issue to share with us, let's have the opportunity for you to introduce yourself to the audience, and then later on you give us your comments. One or two will be adequate enough. Thank you very much. Could I have someone to move around with the microphone to support this? Okay, thank you. Maybe we can take about 3 questions and then we give our panelists the opportunity to respond. Madam Beatrice, is that okay for you? Or you can take as many as 10? Okay, let's have 3 people make comments and then we shall hear. So we have this gentleman, we have a lady over there. And
thank you very much, the moderator and the honorables and the ministry. I am Talivita Moses. I'm the legal officer for Uganda National Health Consumers Organization, and allow me shed light on 3 issues. One is I want to ask the honorables, where is the National Health Insurance Bill? Because if that is responded to, then health indeed will become wealth, and that would mean all of us will be protected. We have been at that advocacy for more than 2 decades, and all evidence has been generated, including how the indigents will be covered, and even what remittances, and even the alternatives that we can tap into to finance health insurance. The second is in relation to registration of persons, NIRA, because NIRA indeed generates the needed civil registration that would inform all responses, especially in the social registry you did talk about. Unfortunately, NIRA has a 20 billion financing deficit, and yet it has to register birth and of course also death, but also prepare us to respond to all the needs that we need. I would implore you that every other time NIRA seeks any funding, please prioritize them. I'll give an example of if any of us paid a visit to the headquarters of NIRA, and you look at those stairs where one has to get up, I know for a fact it is not easy, rather we cannot access it with ease. So it is important that we also look at the headquarters for NIRA. Is it not about time that they are shifted to places where you do not have it competing with other national events? Because that means if there is another national event, they close it, and perhaps it may not. The other is the remand homes. And I will elect to talk about that in Fort Portal. The Fort Portal remand home is the only one, and yet the city is expanding, and of course urbanization comes with the increase in number of children being in conflict with the law. And I am afraid it's not expanding by way of how many children can be accommodated, and that of course means children will find themselves sharing with adults, either at police, and that of course does not support the children, or even placing them at the center of where we want to go. Communities are increasingly becoming very risky for these children, and I think government intervention is very necessary. Thank you.
Thanks so much. My name is Benjamin Waburoko. I work with Save the Children International. And of course, what I'm going to speak will always relate to the age before the 18th birthday. Just have 2 comments to make. And one of them actually goes to both presenters, Beatrice and the Honorable. And just start with the Honorable. I think when you were trying to give us the scale of the vulnerabilities, I know I was reading while you were presenting, but I also realized that the first set where you're talking about the ECD, the young ones before they go to school, and then those that are in school going age, there are quite a number of vulnerabilities. Actually, they were the most. And I also think that if you are going to translate those vulnerabilities into cash that's going to meet all those needs, then it should be proportional. And definitely, even in budgeting, would expect that would also allocate a little bit of more resources, and not just talking about it, but also reaching out to the responsible people that allocate the resources, including the honorables. And when we look at what we already mentioned, that this particular year we have, in this financial year, we were talking about only 121 billion that have been allocated to this sector. It's so miserable. And I think perhaps we also need to rethink why we are not moving to where we desire to be. And probably you could also play another role of course, advising those that allocate the resources by doing a political economy analysis. Who allocates these resources exactly? I know Honorable is here, but I'm not sure, of course, also it gets to her at probably towards the tail end. But a number of those priorities are identified actually at the community level during the budgeting and planning process. So my plea to you from the Ministry of Gender, and of course the Member of Parliament, is again to look beyond what we've been doing usually, but also to look at how to prioritize the younger people. Because soon or later, they will become your voters, and of course they will be competing for this post. So that's where we would have a lot of investment in this. But second point is about, yes, we are talking about developing the policies, the strategies, but I also think that even when you're developing the policies, sometimes I think you also look at the financial compliance. Do we develop policies for the sake of policies, or we develop policies with the hope that there will be resources to implement those policies? So let's look at the balance between the two. And already we have the national child policy, now we have the social protection policy. So are we just developing them, or we are allocating a little bit of more resources that can support that? And the last is the issue of the disability. I know my colleague has talked about the remand home, but I will always speak about the children with disabilities. And we are, of course, sometimes when we focus this, we are looking at basically adults. I'm not saying it's a bad thing, but there are quite a number of children that have disabilities that are not in school, and their parents are in a vulnerable state. So I think when you are targeting, that could be one of the areas that we'll be looking at first. Otherwise, we leave them, and we shall have so many challenges. So I thank you so much.
Thank you very much. Thank you, panelists, and thank you, UDN, for bringing us here. My name is Elliot Olizara. Maybe I need to stand. I work with Women and Girl Child Development Association, and I still serve at Salzburg as the chairperson. And I want just to talk about three things. Thank you, Honorable, for bringing out the issue of having the same sound. I think I would have loved civil society to clap for you. We have been talking about these things for quite some time, and unfortunately, you found when Madam Beatrice had already presented most of the things of which we would want to see government, and you particularly, taking to Parliament. I know very well that you are aware that Uganda is one of the countries that brought in the model of the certificate of gender and equity, which has really helped us to look at those budgets very well. And of recent, I hope you are aware that that climate financing also asked for that certificate. And on behalf of civil society, we would want also to see the social protection having something that pushes us. As we have all heard, definitely 1.7 is still low. Before, we were advocating for 5%. I know there are some members of the Social Protection, Uganda Women's Network, and the rest. And we thought this was very, very important for us to have like the policy makers like you. And when you look at Beatrice's paper, it brought out so many issues. Beatrice, thank you so much. And of which all those issues need money. I know Save the Children was talking through the children issues, and when you look at the ECD. But for me, I wanted to bring to your information that you have even the children between 0 to 5, and you have the mothers of late that have had increased stress.
even the children themselves. Because of those issues that you are talking about, we don't have enough funding, yes, it is true, but how much money do we have, and which area have we prioritized in terms of why do we have to finance social protection? I will end with two things, and I will just put this under Civil Society Budget Advocacy Group, UDN, and the other organization that we do advocacy for increased financing for social protection. Of late, we all know that social protection is under the Human Capital Development, as Beatrice really put together all these issues. But we have had challenges where we think that social protection has only the elderly. We still have a question. The money that we give the elderly, have we tried to follow up to know where this money is going? If, Honorable, you are bringing the issue of stroke, you are bringing the issues of mental illness, you are bringing the issues of diabetes and pressure. But we have had even challenges at the household level, and I think Save the Children, you will agree with me, he's not in the house, that most of the elderly, most of the old women are still looking after the children of the sons and the daughters who have passed on because of HIV/AIDS. Maybe you may think that the financing for HIV/AIDS is under health, but under social protection, there are issues that we want to see that the budget really finances. And that's why that's why I want to buy your model of having the same sound, that as we rethink, we reshape, and we strategize, let's think about the older persons, not the money that we are giving them, but that households where they are and who is there. Lastly, I want to call upon you again, Honorable MP, that maybe this time where we're having the same sound, that we have a strategic meeting after this meeting of how the civil society that are advocating for increased funding for social protection can again rethink through what Beatrice presented. It was an amazing presentation, and there were so many things. I think since we have been really looking at position papers for social protection, we have not been picking them. Allow me to submit.
Okay, thank you very much. We'll give our panelists, the opportunity to respond, and then later on we shall pick again another set of 3 questions or comments. So, over to you, our panelists.
Thank you very much, members, for those issues that you have raised. I think most of them you are reiterating the presentation, and what we want to say is that in the presentation, those issues that I raised are the issues that we assess, that have been assessed over time, that need to be addressed through social protection. And remember, I said that the policy recommends how approaches, interventions to address those issues, but in a progressive manner. And so, yes, there are a whole lot, but also based on the ability of the government to really take on, how much can government take on at a time. I think earlier Honorable said that we cannot say that we can leap from 0.7 to 0.3. No, we have to go looking at the fiscal space that is available. Yes, having said that, I think I want to agree with the last speaker who talked about where the money for the older persons is going. I think, again, in our analysis, we have highlighted that older persons actually look after children. And when we did a study on how that money is spent, you realize that actually the first area of expenditure is food, then it is health, access to get to the health center, and then the 4th is education. But you will say, who are they educating at that age? It is those grandchildren and what. So that is where their money goes, and of course investment. But I think what we need to look at is, given the the way the social protection is analyzed in the Ugandan system, we have that direct income support, which is support given by government or maybe development partners to those that are not able to. But there is also the social insurance, which is contributory. People contribute when they are still able to. You can actually even contribute for education. These days there are packages for education in insurance companies. So we need to promote those areas as well, because we cannot put everything on government. Government will respond to the ones that, those actually that need to, but we need to do actually a dual approach. We need to look at what government can contribute to support those who are not able to, and rightly, like you have said, the persons with disabilities, severe disabilities, really they need that support. Some categories of children will need support. And then, of course, the older persons, that one is very key. But I think the Ministry of Gender, Labour and Social Development is trying to do that. That's what the government is. I talked about the social care and support pillar of the social protection system for Uganda. And that, I think that pillar, when you unpack what is there, when we get support for funding for that, it will help us also to prevent. Because what we are seeing is, I think, the symptoms, we also need to prevent. And so what do we need to do? Looking at the issues of young people, we need to start from parenting. We need to start from addressing at community level. We have run away as communities from what we ought to do. We have, some of us come from clan system, which are very effective. But you look at the clan system, we're only waiting to bury. Can't we do something as a community, as a clan? Can we look at an old woman who is part of our clan, who is sleeping in ash? Yeah? Her bed is in the ash, her house is about to fall on her, it is leaking, and yet we have the clan system. We are waiting for this old woman to die, and then we contribute. So what the social care and support system says, we need to strengthen that support. Let's go back and support. Let us raise children as a community. Let us look after our vulnerable people as a community, while also we promote the formal system for social protection. I think that I want to bring that outright. And I think the other issues that you talked about, yes, including the issue of stress for the vulnerable, for the mothers. That one is also really addressed. The stress for the mothers is not just the mothers, even us at the workplace. There's a lot of stress that is developing, and we need to really see how to address that stress before it explodes. Somebody talked about, I think the one of the certificate, I think I'll leave that to Honorable. Certificate for gender compliance. Yes, somebody talked about the policies that we are developing. There are resources for them. I think I want to say government policies are developed to guide, to provide a framework for how government thinks that an issue should be addressed. And so for as a government, we have developed those policies, not just for government, but it's for all of us. So usually, of course, the funding, we need to check if there's funding, but we are also looking at what else is available. What can other stakeholders do? What can the development partners do to contribute to this? What can civil society do? Private sector also should be able. I think what we need to do, as much as we are trying to mobilize more resources from government, we also need to strengthen that coordination so that we are able to put the resources into proper use and really prioritize interventions. The issues that were raised in the presentation are many. Even if you put it to government, the government will not find the resources to do it all at once. So we need to prioritize. That is what we are talking about. And But when we collaborate well, when we coordinate the available resources within the country, private, ourselves also to support, we should be able to reach there. I think the other speaker talked about a number of vulnerabilities, again, that were raised, especially for young children. Yes, again, for me, I think with that has been raised. We have also done analysis on how much that might cost. Of course, to support children, if we go the cash transfer way to the vulnerable, it is quite high, and we're thinking that we need to really go through a phased manner. But again, like I said, those vulnerabilities of children, we can actually use the traditional mechanisms, the community, to also support the formal mechanisms that we are proposing here. That is what we would like to say, how we can take it forward. The 121 billion that I mentioned there, I think that is just for the senior citizens grant, but there is also, of course, the public service pension is still funded under government. We'll look at that, but also the programs like this, the persons with disability grant, as well as the senior citizens grant, that all is coming from government. But I think, yes, we need to prioritize, and we have rightly said that we need to address the issues of children so that we can be able to take advantage of the demographic dividend. If our children are well educated, we will really be able to reap and maybe expand on our economy, and that is well noted and something which we are considering to implement in a phased manner. Thank you.
Okay. Thank you so much for the comprehensive responses, Madam Beatrice. Health consumers. You asked of something that every other Ugandan is asking about, the health insurance bill, the health insurance scheme, which is a very long-awaited scheme by Ugandans, but I would say that this bill, of recent, it was being discussed both by the Ministry of Health, the Parliamentary Health Committee, and the whole House of Parliament, and everyone was like, we need to start. We should have started even yesterday. Well, it's something that when it started, you prepare and don't ever expect to fall back. I would have a thinking that because of scarce resources, that is why its progress has been slow, but at least of late, we took a significant step, and everyone was like, we need to see this starting. You said 2 decades. Yes, I agree with you. It has been a document on paper work for the last 2 decades, even more, but soon I think what we are cooking will soon be ready, because as Parliament, as Health Committee of Parliament, as Ministry of Health, we are saying we should start very soon, not later. I would like to also add my voice to your voice, Beatrice, where you said that traditional and community mechanisms need to have a big role to play, not wait for only formal mechanisms. And I would think that our implementing partners and the civil society organizations can play a very significant role here, because if we look back into our communities, communities are well organized in programs of burials, and I think it is everywhere. It is across all regions of the country. They are well organized in programs of burials, funerals, to have decent send-offs for their dear ones. But when it comes to other programs like healthcare, education, you know, all these key social services, people are not organized. But I have a thinking that as civil society organizations, as NGOs, as government, we have where to start from. Because people are already organized out there in communities, but they majorly put all their efforts on burials. So if we could come in with the concept of now planning for themselves on these other aspects when they are still alive, we can get a very good landing site. Yeah, we can get a very good landing site because they are already organized. They should not have this thinking that all the other programs, it's the government to plan for them, and for them they only plan for burials. So we need, like Elliot Rosaro said, that it would be good for all the partners and the civil society organizations that are here that are advocating for social protection to meet once again after here on how the funds can be increased, the benefits, and also the lowering of the age. These, I would implore you that this is also one of the key issues you should discuss on how you can best utilize these organized groups in communities which are planning for, well, burials are also important, but for me, I would think that they are not as important as these other aspects like education, health, and the rest. So, in the next meeting, see how best we can utilize these organized groups. And now for us as politicians, it is even worse. You find a single LOC1 cell having like 4 different groups of organizing themselves on how to support each other when they lose their relatives in one cell. So which means when these people are penetrated at an angle of these other aspects, they can comply. They can comply. We may not get much resistance. Most of the other things were already handled. Yeah, basically that is it. And when we go into that, even we shall cover our elderly people suffering with the orphans of their children who have also passed on because of conditions that we would prevent through these social protection programs. I thank you.
Moderator, let me just say something about the remand homes.
Sure.
Thank you. Yes, I think we do note the issue of the remand homes. Again, we have that analysis, and we know that they are in only a few regions. And then the strategy that the ministry is deciding to take is really not on expanding, although of course you cannot avoid maybe holding centers. But we're looking at, again, reducing, because good social care, the other pillar of the of social protection that I talked about, entails that you don't keep the children. The more you decongest those holding centers, the remand homes, that is the better outcome. So we are really looking at the causes. What are the causes? What is causing this? So that pillar of social care is looking at addressing the issues that really drive children to crime and get to those centers, but also other means. Can we divert, if it is not a serious capital offense, or can we divert other means of justice, arbitration, or within the community? So that is, again, what the ministry is trying to look at, but also the expediting justice, because these children are not supposed to be held in those remand centers for more than 3 years. If the justice system, if they go through the justice system within that time, then we should be able to release that space. But actually what is key, the strategy that the ministry is leading, directing the country, is that we need to address the root causes. Why are our prisons filling up? Why are those remand homes filling up? How can we have a diverted justice system? Let's do it at the community level. Maybe not, we don't have to go through that. Not everybody needs to go to that remand home. What other system can we use? So that is what is happening. I think on the issue of NERA, that is really well noted, and we are in social protection, we recognize that NERA needs to be fully capacitated to be able to deliver the national ID, so that the beneficiaries should be able to be reached. Even the social register that we are talking about, we really need the citizens to have that identification. That is the only way we can be able to reach them and be able to be accountable. Thank you very much.
Thank you, Ms. Beatrice Okelan, as well as Honorable Sylvia Barreira, for your discussions and the responses. We'll go back to the audience again to have a set of 3 more questions or comments from you. But before that, I just want to welcome those who have just joined us. Please, we're gathered here for this public dialogue organized by UDN, and we want to thank you for coming for this session. Yeah, so could we have the next 3 set of questions? Okay, wait the microphone. Can someone, UDN, can someone help us to move the pass the microphone around? We'll start with, let's start with Dan. That, from that line. Then at the back side, and then we'll end with.
Thank you, moderator. I'm Daniel Kaseregenyi, Deputy Director, Gender, Welfare and Community Services, KCCA. I really appreciate you, the moderator, and all the panelists. Much appreciation to my colleague Beatrice. I wish to also make this quick addition on the social protection programs in KCCA. KCCA is currently pursuing a pilot social protection program strictly targeting the girl child, the disadvantaged girl child, that is between 11 to 15 years. And we are looking at both in-school and out-of-school girls. The program gives peer-to-peer mentorship and cash transfer to disadvantaged girls, with the notion of making sure that these girls should be able to afford basic necessities to keep them in school, for those who are in school, and to enable them start a business for those out of school. To ensure this, the disadvantaged girls should be able to transition safely into adulthood. To date, we have covered 3,000 girls supported, and this is with support from UNICEF. It is a pilot program, and if at all it works well, we wish to propose it to government to make sure that it is rolled throughout the entire country. Secondly, let me make a small input on Gilbert. Gilbert was the first presentation where you mentioned PDM as one of the additional funds for social protection. But we also need to quickly look at PDM source of funding as leveraged funds. These are resources previously scattered within ministries and departments and agencies, now put together into PDM and delivered directly to the people at the parish level. This program, program-based budgeting has somehow disadvantaged some social protection interventions at agencies like KCCA. I want you to look at the sensitization programs, mobilization programs, advocacy for special interest groups like PWDs, youth, children, women, elder-related activities, including the rescue, rehabilitation, and reuniting street-connected children with their parents and communities. These are now left unfunded because these are the same monies we are using to do these activities have been leveraged to constitute PDM. So this is the kind of information we need to clearly give to the public, that the budget have not just been cut, but the money has been consolidated to deliver PDM. Thank you very much.
Thank you. Good afternoon. My name is Roderick Atare from Ministry of Health. I would like to just give us a very quick update on the health insurance scheme. We received, we were asked by HE, His Excellency the President, to review the bill itself because previously it had already been tabled, but he had some issues, especially with the private sector on inclusiveness, on the packages, and also on the financing. So when it was returned, we conducted an actuarial study with stakeholders like the Insurance Regulatory Authority and also with the private sector. So right now where the progress is that we have prepared the cabinet memorandum, an addendum to the one that was sent before, where we are waiting approval from the Minister of Health, Honorable Cheng, so she can discuss it in cabinet. So we are ready, the bill is ready, it has been reviewed, all stakeholders have agreed, so we are only waiting for it to be tabled in cabinet, and then cabinet will recommend the way forward. Now, my question, this is aside from the insurance, this is a question to the honorable members of parliament as regards to financing. I don't know whether there has been a specific study done on the return on investment for increasing social protection, because I believe that we already have different interventions that are going on as we speak, but is it really necessary to increase or to push for increasing of our budget when we have other projects and interventions like the policy, the parish development model and other activities done by other stakeholders? So is it really key, or is it going to make economic sense if we increase money for social protection when we already have parallel government interventions that are going on. Because in my view, we've been calling it evidence-based. So I believe that we will need, or we need to see the evidence on what it will cost and the effect on the, on the outcomes of social protection at large. Thank you.
Thank you. Let's have the microphone in front here.
Thank you, the moderator, the Honorable Member of Parliament, Madam Oklan, and the House at large. My name is Wanyaka Hussein from National Planning Authority, Department of Population and Social Sector Planning. First is my humble request to Madam Oklan, if you can share your paper you've just presented. And you're very well aware that National Planning Authority is doing NDP4, so we can read through and see what we can put in. Secondly, it's something to think about for Madam Oklan. In Uganda, we don't have nursing homes, and this can be one of the social protection for the elderly. All of us are going to grow old, and we have all talked about old age. We are educating our children in international schools, outside the country. You end up living alone at home. If at all we have nursing homes in Uganda here, our children, maybe if they have the money, they can pay a nursing home, and we are taken there, taken care of by special people with skills, doctors, nurses, and caretakers. And on that note, this can be as business. You know, when you're vulnerable in a place like Uganda, you beg for money, they're going to keep away your budgets all the time, but have a basis of where you can talk from. Talk about having nursing homes. People with money can pay, and this money can go around to do other things for social protection. Then I've looked at, actually these nursing homes can go to Ministry of Health. You can discuss with them and see how they can incorporate them in their plans. Then another problem we are having as social protection, we lack awareness. Awareness is limited. When I go to my village, I always ask who knows about parish development model. But what they know, they only know that pillar of financial inclusion, and yet it has 7 pillars. So awareness, I don't know which department is supposed to do awareness. Is it the Ministry of Gender? Is it OPM? Is it what? I don't know. So we need to do a lot of awareness. My name is Wanyaka Hussein from National Planning Authority, Department of Social Protection.
Thank you, Mr. Hussein. Thank you, Roderick, and thank you, Dan Kasser, again, for your comments. I'll straight away hand you over to our panelists again to give their responses. But before that, may we welcome Mr. Onyang Joshua. Marvin is from the Uganda Parliamentary Forum for Social Protection. After these responses, we want to, of course, hear from you as well or on the topic that was presented this morning by Ms. Beatrice Okelan from the Ministry of Gender. Thank you very much, and you're most welcome. For those of us who have just come, please, we want to welcome you to this session. As we mentioned earlier, we are here basically to deliberate on issues surrounding universal coverage of social protection in Uganda, organized by Uganda Debt Network, and want to thank all the partners involved in this. The Ministry of Gender, Labour and Social Development. Want to thank UNICEF that is funding this. Want to thank EU, the European Union, that has funded it. We also have other partners that include ILO, International Labour Organization, as well as the Global Coalition for Social Protection Flows. Like I mentioned earlier, we are live on NTV, and for those of us who are following this discussion, please join us on social media. We will reserve the next sector of questions for those who are following us online. Just to remind you, please, the hashtag is SPPFM Uganda. That is for Social Protection and Public Finance Management Uganda. SPPFM Uganda. That's what the hashtag. Please feel free to join us and share your questions and comments. In the next sector, we'll reserve this for you. May I take this opportunity to invite our panelists to give their responses, and then later on we shall also invite Marvin to share something with us. Thank you. Over to you, Beatrice and Honorable.
Yeah.
Thank you very much.
Let me say something, then you proceed. Thank you. Mine was, okay, the majority of the things were touching the presenters, but I'm glad somebody from KCC has raised some issue which is pertinent. And KCC, you didn't also talk about our problem of street children. You would have heard about it. That's one of the things that touch people. But the fact that PDM 1, as it was drawn, some of the resources were taken from some of the crucial sectors. But of course, the majority of the resources were kind of new. But it's indeed a painful experience if some of the sectors ended up suffering as a result of creating an extra program. Like, so playing within the same budget, it may not be good. But one thing that you have reminded me of is the cost of doing business. When we look at the kind of monies that are used in promotion or in moving around, doing what PDM, when you find, say for example, the Prime Minister having come to distribute the 1 million, but then, okay, or any other officers for that matter, you have come to supervise an activity, but the cost of supervision, the cost of doing business being high. I think we may need to revisit that area so that at least we have structures on the ground, and these structures can be trusted. Of course, we have accountability mechanism, that they are trusted so that they are addressing the issue of of allocation of resources in those other areas. I think so that the majority of the money, the bulk of that money, goes to PDM or any other of those programs. And of course, related to that is the commitment by government of recent that there would be less overhead expenditure and more of service delivery. Lastly, to the MP, I grabbed the mic before she comes. I wanted to use this opportunity. We have Honorable Onen here and Honorable Sylvia. UDN had a chance to facilitate you to move around the country, and you witnessed a number of things in social protection area. And I'm asking just this simple question for the members, that is there one thing you saw as a member of parliament when you moved around in these places, which you would like to share and which you feel like you might address? In Luganda, they say, akatalekeka, something you can't leave behind. When you go back, when you sleep, something you keep on remembering. Please touch that in your responses. Thank you.
Thank you. Thank you very much. I think the first two members raised comments, so they were also responding to the issues that we earlier on raised, so I will not go into that. that information was provided. I want to respond to the question on why we should have social protection parallel to others, PDM funding. And I want to just reiterate the fact that I think you talked about evidence. Evidence is there on how social protection contributes to national development, but also, again, from the presentation, from the analysis that we have done, the approach we have taken as a country, there are those that cannot do what we are supposed to do under PDM. I don't know whether an older person, 80 years and above, I know there is a package for them, but what is the condition? They're supposed to work because the money is supposed to be revolving. So are they able to, at 80 years, 75, we want these grandparents to continue working, to earn their own living. After all they have done for us, they contributed to the development of this country when they were able to, but just that the systems were not in place. Maybe they could have contributed to their own social security. But now that is what we are starting to do. We are saying, okay, there are those that have fallen off the cracks and we need to support them. But going forward, we also need to sensitize the communities. They need to know that when you are still working, you can contribute to your own social security, so that in the near 10 years or 20 years, we should not be burdening the tax. We should be able to leverage from our own contribution. So that is what we are asking for. But just to say, if we are saying because there is money for PDM, should we stop giving older persons, the persons with severe disabilities, those that are carried, those that cannot walk? I think I will leave that question again. I will not answer it, but I'm just saying that you look at what it is. So also we said, what is the money used for these older persons? For example, we have done analysis on how the older persons use the money. Earlier on I said, I gave in that order, but they also use that money to open up their land. You know, they give those that are able to hire labor so that the young people can help them to open up their land. Otherwise, some of them were living in bush, they could not even do anything with the bushes around about them. And so we think that, yes, PDM is good. There are those that are able to work. That is good. We are not saying that, like in the presentation, I also say that we need also those other services, the livelihood programs, to move on, because there are those that can. It's also good actually for social protection. For those that can get the money, work, they should also contribute for their own social retirement, for their retirement. So we think that we can work together, but we cannot say that we should stop funding social protection because of that, because what I've seen. The gentleman from NPA, yes, you rightly said, I think we'll avail that, but we will also be available to work if there is need for further work, to see what other analysis we might need to do to ensure that NDP4 incorporates social protection and takes it to another level. Beyond maybe just a project, can we uplift it to a program? So that is something maybe we would need to look at. You talked about nursing homes, lack of nursing homes. Indeed, I think we recognize that. But the policy of government is that we do not want to institutionalize at the moment. You have actually raised issues of what we are doing now. We all want our children to go abroad. We are not looking at what happens later. But again, under the social care and support pillar, which we are just developing, we are looking at that also. But again, nursing homes is like those that maybe they might need support, maybe during the day, maybe to do with some work, but they should be able to go back to the community. So that's the approach that we are looking at. And again, in that social care framework that has been developed, we have there are various roles, and Ministry of Health will lead on that. We will, of course, discuss with them, like you have rightly mentioned. But what the Ministry of Gender, of course, needs to do is to develop the standards. We need to watch the standards. What kind of quality services are we providing to our people? Should be quality standards. So Ministry of Gender will take care of that. But also, we should be able to regulate the workers, who are these people who are actually providing the services, the social care services, maybe the carers, who are the carers in that home. What skills do they have? So that is what that framework has. And like rightly you have said, that the private sector will lead, but we need to work in collaboration with Ministry of Health to ensure the standards, but also the MOUs, and ensure that the standards that have been put in place are followed. For awareness, I think I cannot agree with you more. That there's need for us to do awareness, mobilization, and indeed from, I think, the NDP4, you know that is also the role of the Ministry of Gender, Labor and Social Development. So that is well noted, and we notice also in all this we need to create a lot of awareness and sensitization. People need to understand what is out there, what can they do, what is government doing. So that information is very important that it goes out in a correct manner. Thank you.
Thank you very much, my fellow panelists. And much as I'm not the moderator, I'd like also to take this opportunity to welcome the ED, Uganda Date Network, who has just come in. Patrick Tumwebaze, you're most welcome, sir. He's the organizer of this dialogue. So the people who gave in submissions or questions, they were pertinent questions, and most of them my colleagues have answered. Dan from KCCA, that is a very good program that you are implementing at KCCA. And how I wish at one time we could see it reducing street children, especially the girl children. Let me hope that they are also inclusive in this program, because I would think that street children, to me, really it's one of the disasters or disgraces that we have in this country, that we have in this capital city. So let me hope that this program shall yield significant results, especially on the girl child on our streets of Kampala. The age bracket you mentioned of 11 to 15 years, these are all school-going children. They are school-going girls. And so sometimes you keep wondering why the government has injected in a lot of money, especially in the education sector, by offering an opportunity to all Ugandans free education through universal primary education, universal secondary education. Now we have skills centers all over the country, you know, hubs everywhere for skills, but we still see people between 11 and 15 years dropping out of school. So we ask ourselves that, where does the gap come from? Of course, the major gap is from parenting. The government cannot give you a program and again it comes to your home to push you on how to utilize this program. So the major gap is on parenting. And of course, at one time, all of us cause a gap in one way or the other. As you know that we are supposed to socially protect each other. So I hope that in the component of, because you have two components of cash transfer for those whom you encourage to begin some livelihood initiatives, businesses, then also peer mentorship. Let me hope that in this program, the peer mentorship brings in more school returnees through the peer mentorships. Those who will have dropped out of school, you get a good number of them deciding to go back to school. But otherwise, this is a very good program. We thank you for that, and we thank UNICEF for funding KCCA. Except this program, if you are focused, of course, you will keep on monitoring, you will do research about it, and you see how it has contributed positively to this problem. But also, I would implore you as KCCA to moving forward in future with better results and more partners coming in to support you. You would take on everyone, not only girls. Not only girls, because our boys are equally vulnerable. For example, for some of you who have been victims of, say, robbers and people who take, say, mirrors from cars when we are in traffic jam on our streets in town here. People who do that are boys. They are men. So it means that at one time, they were neglected as boy children. And they end up on streets to steal and do every kind of havoc. For me, my car has been removed off the mirrors about 3 times around Clock Tower there. And when you go to police, when you're from Intewa, around Clock Tower there, when you go to police, they tell you that we don't know what to do with these boys. It is their daily work. We have tried our best as police, but we are really failing how to handle these boys. Can you imagine? Can you imagine? Why? At one time, these boys were neglected. We have focused a lot on girl children, forgetting that our boys are also in a very sorry state. So I would implore you, KCCA, in this very good, important program in the future, to include everyone, all children that are vulnerable, so that moving forward, we see less thieves and wrongdoers on the streets and everywhere. Then also, at Haire from Ministry of Health, thank you for giving us further update on how the Ministry of Health has gone with our health insurance bill, and you also asked on if there is any research results that give us a picture on the investment return on the programs that the government has been implementing, pushing a lot of money into communities, especially that at the end of the day, these programs protect our people socially, our vulnerable people socially. Yeah, the government has done a lot of programs in our communities, and we are actually grateful to the government. The likes of Myoga, Operational Wealth Creation, WEP, Youth Livelihood, and the latest one is Parish Development Model. Well, much as we have these programs, you ask that if it is really necessary to add more funds for social protection, and yet these programs have also been feeding into social protection. Well, we see that our budget is at 0.7%, and we have to agree that much as these programs are there and have done some good work on the ground, we still have to increase the budgeting, the financing, because there are areas that have not been tackled. There are areas that have not been tackled, because if we look at areas that are not direct, ill health that leads to many orphans in our communities, that lead to our old people looking after these orphans. Like Elliot said, some of these areas still have gaps of funding. But I would think that the return of these monies, most of these monies are revolving funds. People have tried to utilize this money well and are actually returning these monies to where it's supposed to be returned, and other people benefiting. But I would think that a very comprehensive study has not been, I've not heard of any results on a very comprehensive study on this. And to me, I would think that monitoring programs is very, very, very important. Actually, as a country, we lose a lot of money through poor monitoring systems, monitoring and evaluation, than corruption per se. We keep on singing corruption, corruption, but I see we lose a lot of money through poor monitoring systems than corruption. For example, when we were moving around the country in different districts under the support of Uganda Debt Network, like my colleague Honorable Nen has just told you, moved us around in some districts to see how social protection programs are moving on. And we realized something I cannot live without saying, like you requested. We realized that the government pushes in a lot of money in some of these programs, but the technical people are the political leaders who are supposed to monitor these programs, are somehow handicapped. Yeah? Are somehow handicapped. Handicapped in such a way that they sometimes even don't have means of transport to reach out to the beneficiaries of these programs and give them close monitoring so that they ensure that the programs move on well. So if you find like a whole CDO of a sub-county not having a motorcycle, a sub-county is relatively big. You cannot move around it on foot or on your out-of-pocket border transport daily or on a bicycle. So if you find like a CDO without a motorcycle, it impacts on us at the end of the day. Monitoring becomes poor. If you find that these monies come in big sums, the government has injected in good monies, big sums, but you find the program comes with very minimal operational budget. Operational costs, people are there struggling. People are struggling to monitor, to oversee a program of billions without any budget. So that's why I'm saying that we end up losing a lot through poor monitoring systems than the corruption. We think that our people are corrupt. They may not actually be corrupt, but poor monitoring systems. So actually, when we were in the field, one of the areas we committed ourselves as political leaders, working with you, our partners and civil society organizations, is to advocate and push for operational costs so that the right people who are supposed to monitor these programs do their work effectively. Do their work effectively, and we register significant results. Basically, that is it. And I wish, but no problem. I think our space has not been favorable enough, but Honorable Onen, you will have to submit something on this also. If space had allowed you, you would also be here. So with that, I beg to submit.
Okay, thank you very much, panelists. It's good you have preempted that. I want to invite Honorable Odoi to just say something. He has a comment to make on the initiative by KCCA, and then after that we shall have Marvin also share with us. Honorable, you're welcome.
Thank you, moderator, and the panelists. I want to draw our attention to Mr. Dan, the Deputy ED from KCCA. You have a very brilliant program targeting girls aged 11 to 15. Just to add on what my honorable colleague Honorable Sylvia submitted. If you look at the population of this country, from 0 to 15 years, your target is 11 to 15. That age group alone constitutes 49% of our population. But also, when you look at the difference in population between the males and the females across the country, you realize the population of the females is around 23.15 million, and the males are 22.7 million, giving a difference of only 0.64 million females than male. The question is, very good, brilliant program preparing these girls for our country. But at the end of the day, you are not doing enough to prepare the boys. Whom are we preparing these girls for? Are we saying the boys don't require this mentorship? Are we saying the boy child is naturally gifted and talented, so they don't require these incentives? I believe no. I want to challenge KCCA. I come from a background of waste management. I do garbage collection in this city. What if in your good program you bring about these youths, these brothers of ours, train them to supplement your team on waste management? We move along these streets and you find garbage everywhere. You find litter everywhere in the slums that your big trucks can't even reach. What if you start supporting these very boys and they become part of your workforce tomorrow? There's a lot of okugogole emyala along our drainage facilities every time it rains. These are the jobs that can be done by these very youths we live on the streets. If you move around the slums here where we live, Namuongo, Kisenyi, Naguro here, there's a lot of mosquitoes. What if you train these youths to actually carry out fumigation and pest control? Won't they be productive citizens? But also aware that we have so many startup programs like the youth skilling under the President's office. What if in this good program, with your partners, you identify also our brothers and train them to be part of this revolution? Are we not preparing them for a better country? On the other issue raised by a brother from Ministry of Health, if there is a study on return on investments between interventions like SEG, UWEP, YLP, vis-a-vis PDM, aware that Paris Development Model targets only 39% of our population who are outside the money economy, aware that these other interventions like Youth Livelihood Program targets our productive youth who may be having skills or projects but lack funding. Aware that our elderly people cannot be very productive at their stage of life, we are aware how our PWDs suffer to even get that belongs to them. I believe we are very much aware that whatever study that can be taken cannot bring results against these other projects. We need this cause, we need these interventions to continue supporting our vulnerable of the community and ensure they get into productive ventures. My mind on this should be us as leaders to call on PPDA, Public Procurement and Disposal of Assets, an entity that already has provisions in the laws that a particular segment of procurement within this country should be left for the youth, for the women, for the PWDs. I think our concern should be to hold their feet and take to the fireplace to ensure that this is implemented. That as our youth, as our PWDs, as our women get this support, they have a share of meaningful engagement where they can realize profit. Because we have provisions within the PDA that a certain segment of procurement locally here should be left for our people. If we don't do this, we are not having a very meaningful intervention for our people. We need to do this to address the issue of the day. About awareness, as I conclude, across the country we have what we call RDC airtime on radio, across the districts. This can be exhausted. But also Uganda being very religious country, very religious, we can use these platforms that every time we gather to seek the grace of God, we speak to our people about these interventions. When we are in churches, we are in mosques, even when we go for burials, even in weddings, it is incumbent upon us to address this and ensure the information reaches our people. I thank you.
Thank you very much, Honorable Doi, for your remarks. I want us to use this next 15 minutes before we close the, this session, which is live on NTV, to just hear from Marvin, and then, of course, later on we'll invite the ED as well to give us some few remarks, and then we'll also invite someone from UNICEF to give us some remarks, closing remarks. So Marvin, please take away.
Yes, thank you very much. My name is Joshua Nyang, Marvin Joshua Nyang. I work with the Parliamentary Forum on Social Protection, and we have been at the forefront of advocating for increase in the financing for social protection and coverage of social protection. So this topic that you have been discussing on is something that we do in our daily practice. Before I make my submission, I would like to recognize the presence of our coordinator, Patrick Katawes Choncho. In fact, I'm seated in his place. We had to rest here because we had different meetings that we had already committed to, but I'm glad that we've both made it to this occasion. To keep the conversation relevant, I think I found discussions around the PDM. That is what I came in and I heard from my fellow discussants. And I think the key issue there is, the key issue that I would like to raise is government brought up, UBOS gave government this idea that 39% of Ugandans are in abject poverty, which is true to an extent, but we cannot verify that. The reason we cannot verify that is because we do not have that data. We tasked UBOS to present the names of these persons who constitute this 39% that PDM is targeting. And of course, there was a gap. You remember very recently during COVID as well, we when we had an emergency disbursement of funds, we did not have the right populace to target. So what am I trying to bring out here? We need to aggregate this data. And currently we have what we call a single registry. So what a single registry does is it aggregates data from programs which are already dispersing these social protection funds. But that is not a proper targeting mechanism of the populace. That is targeting at individual level. And I think that is also another issue that we have, individualization of poverty. Most of the development programs that we have target individuals. And yet we know that when an individual faces a shock, most of you and I who are in the community, you realize that when an individual faces a shock, it does not only affect the individual, it affects the household. So what I'm advocating for is what you call a social registry. A social registry would entail getting data at household level and ensuring that this data is regularly updated so that in events of shocks, the government can easily target, can easily disperse and say, if we want to target the poorest 10%, who are these people? Who are their names? How do we reach out to them? You did realize that when we're targeting during the COVID relief, there were a lot of cases of corruption, money being sent to the wrong persons. But if we had this data readily available, we would very well target these people. I'm also well aware that we have the PDMIS that is being used to capture the information of the persons that they're targeting under the PDM. But then this also brings in the element of drawing synergies. We need to draw synergies from all these various social protection complementary programs so that at the end we are able to, if we are tasked, for instance, by Ministry of Finance to state which percentage of the populace is benefiting from social protection, it's very easy to have that data readily available. The other thing, as we are on this issue of increasing coverage, is the projectivization of social protection. I think we lose a lot when we get projects that run for 5 years. People benefit those projects. They are not graduated off those projects. Then after 5 years, they are back to the same state. So how do we aggregate this? How can we, for instance, get the cream of these projects? I'll give you an instance. We have the Child Sensitive Social Protection Program which is targeting 8 districts in West Nile. This program targets pregnant mothers and lactating mothers. The reasons why they chose West Nile, of course, they did their own mapping exercises and determined there was a very high number of children who were stunted, a high number of children who had anemia, and they thought that was a good place to pilot it. But these are not the only people who need this sort of intervention. So how can we get government to look at some of these projects that these development partners, for instance, are implementing and ensure that we can utilize that to uplift our populace? So with that, I think I would like to hand over this conversation back to the moderator because we are, I think, short on time. I apologize again for coming late. Thank you.
Thank you very much. Another round of applause for all our panelists. Yeah, so I want to thank our panelists for ably taking us through these discussions on the status of social protection in our country. I thank Ms. Beatrice Okelele, who is the Policy and Advocacy Coordinator in the Ministry of Gender, Labour and Social Development. I want to thank the Honorable Sylvia Bereira, the Woman Member of Parliament for Kamwenge District. And I want to thank Joshua Marvin Onyang, who is from the Parliamentary Forum on Social Protection. At this moment, I want to invite the Executive Director of Uganda Date Network to give us his few remarks in 3 minutes. And then I'll also ask him to invite Mr. Tawanda from UNICEF to give his closing remarks. And then we'll close the live segment of this session. But we'll definitely continue with our discussions and interactions off TV. Thank you, Mr. Patrick.
Thank you, Mr. Moderator. I think it's so low, I'm so tall, I think. I want to apologize. I was not feeling very well, but I said I must come here. And I know I have a little time. I don't think I'm going to give the remarks I should have given because I know the TV is closing. But allow me, before I call Mr. Tawanda, to give a vote of thanks. I'm not going to the protocol. Allow me, please, because of the time. But all protocols observed. I want to send a vote of thanks to, first of all, UNICEF, with whom we've been doing this project and funding us. And I can't forget the back donor, the EU. Thank you so much, UNICEF. I want to thank the Minister of Gender, Labour and Social Development, with whom we've been actually implementing this project. I also want to thank the Parliament of Uganda. I want to thank you, Honourable Sylvia. I want to thank Honourable Nen. I want to thank Anita. These people I had in Kamwenge. I also want to thank the media, NTV. I recognize the contribution of done to this project. I cannot forget also to thank our local governments. We've been implementing this project in 80 districts plus the national level. Allow me to mention these districts, Mr. MC, Kamuli, I don't know if they're represented here, Tororo, Kamwenge district, Singiro, Kapelabyong, Moroto, Nepak, Kiriandongo. This is where the project is being implemented, for those of you who do not know. I want to thank them so much for their support, for the success of this project. I cannot forget to thank, of course, our panelists. I don't have to mention their names. The MC has mentioned their names, for sparing time to come talk to us. Thank you so much. I can't forget to thank my colleagues at UDN, and I'm glad we have even a panelist here, Mr. Gilbert Msingzi, for all their work they've done for the success of this project. With those few words, Mr. Moderator, because of time, Mr. MC, because of time, allow me to invite Mr. Tawanda. The other name, I get a problem announcing it. Chinemberi. Mr. Tawanda Chinemberi is the social protection policy manager at UNICEF and has been so supportive to this project and also UDN work. Thank you. You're welcome, Mr. Tawanda.
Good afternoon, everyone. Good afternoon, everyone. Thank you. Thank you very much. Honorable members of Parliament here present, UDN leadership, board members, colleagues, friends, thank you very much for coming. As usual, I wasn't really prepared to give a speech or to say anything. But I like Patrick because he always wants me to say something. And it's always very difficult. I'm not a good person who is good with speeches, especially reading speeches. I always want to speak because I don't believe I should be reading my own speech. You just speak whatever you do. And I realize that sometimes when I start talking, I'll say, okay, finally, my last point. And then, in summary, it's like 30, 40 minutes of speaking on this subject. It's simply because of the passion that, personally I have, but also the organization that I represent has on social protection. And I think UNICEF as commitment to supporting social protection remains the same. It remains intact. We keep on working with all the relevant stakeholders from the ministry to Parliament and other partners like UDN. And I think the journey that has made us gather today is simply because of the support that we receive from the EU, together with our partners, Helpage International, as well as the International Labour Organization. So we thank them for the support. I really don't want to get into giving a speech, but just to also share, I think, our view that social protection works and indeed works. It can change lives. It has done so. And I think from the little efforts that we have had as partners, maybe not only as UNICEF, but many other partners, UN partners, NGOs, and so on, implementing different projects on social protection, we have seen, I think, a lot of change. We have seen a lot of impact. I know Daniel was talking about the KCCA project that is targeting girls and how much that has transformed all those girls that we have had. Honorable members, I just want to say, I think I was asking last week, we recruited, I think, about 750 girls in September last year, thereabout. By the time that we were checking, so 750 were out of school. By the time that we were checking when the second term reopened, 500 of those 750 girls had gone back to school, out of their own decision. So this was not because they were being forced to go back to school. The intention of the program, especially for the out-of-school girls, is not necessarily to push them to go back to school, but to choose the right path that they think they are good for them. So those that are choosing to go back to school, 500 out of 750, the other ones are choosing alternative paths. Nothing changes with regards to the support that we give them. But we feel strongly that that decision, that a girl is empowered enough through mentorship, through the cash transfer to go back to school, is the right decision, because they are making this by themselves. Because we see a lot of challenges, for example, that happen with our girl child. Generally, when you look at the that children have, almost half of the population is children. It's really quite a big number. And I think a lot needs to be done for our children, and I think we have an obligation to build a better future, a prosperous future, not only for them, but for future generations if we invest in, in children. We are still spending much, much less than perhaps we should. We know the country faces a lot of challenges with regards to fiscal space. And I think as UNICEF, we have really committed ourselves, and we continue to do so, that we are willing to support government and partners to try and explore alternative ways to really be able to support social protection. When it's still less than 1% of GDP being spent on social protection, I think even if you compare with a few countries within the EAC, we are really, really way, way behind. And I think something needs to happen. Something needs to happen. There's a lot, I think, that perhaps we're missing in Uganda. We know, yes, there are so many other priorities, but I think that deliberate effort for us to really be able to focus on improving the situation with regards to social protection is really quite, quite compelling. I know, Honorable Member was talking about the whole issues about children on the streets. When you look at the numbers and the estimates that look at the numbers that come into the streets every day, it's really not good. Something can be done to prevent that. Something can be done to build the future for those children. Each and every year, we struggle all the time that when it comes to the time for the for the annual budget, we are looking at the framework paper numbers. And, you look at some of those things, for example, things that happened last year, not only with SAGE, but we saw what was happening with remand homes and so on, which perhaps were almost getting closed. When you look at the numbers that were there then, we know the situation changed. But I think if our focus is clear,